Great, thank you very much, thank you. Well, I feel very privileged to be able to speak to you and discuss with you this project that we've been doing for a long time. And we've been trying to get patient feedback since 2005 and even before that, and didn't think there was anything particularly interesting or even worthwhile about it. I thought it was pretty much what you tend to do anyway. But it appears that this isn't as widely practiced as it might be, and we've been able to demonstrate some value and use in our practice. So I would like to sort of share this with you, some of the work that we've been doing, and really ask you to look at what we're doing, challenge what we're doing, look to improve what we're doing so that we can better serve and improve the outcomes for our patients. I just put that slide up because I think that figure 80 billion is relevant for our conversation and about long-term conditions. But obviously this is, the NHS reform. I'm a clinician, so I'm going to start with a couple of cases with you and have a little bit of a conversation with you. If I probably run out of time, I'll be marched off the stage. But anyway.
It's ticking away.
Oh, my goodness, a minute and a half already. I didn't realise that. Okay, well, there's a couple of cases. I won't necessarily sort of spend too much time on them, but they're both patients with rheumatoid arthritis, and one seems to have a better outcome. And hopefully we're going to be reducing and stopping her treatment shortly. And the other one, I've got nowhere to getting her start treatment. I've actually only seen her on a couple of occasions for 15-minute appointments, and so far she's actually not having any treatment. That I've been able to prescribe conventional treatment. And so the question to you is what needs to improve? How can we better serve this patient? So you can have a conversation with your neighbour. I'll give you about 15 seconds, otherwise I'll be using up too much of my 20-minute allocation. Yeah, complementary and allied medicine sort of things. So she's having herbal treatment. Sorry? That's right, yeah. Any sort of thoughts? What needs to change here then? I mean, just shout something out. One from this side and another one from the other side.
Does she recognise that the current treatment is failing?
Well, that's definitely a point, but she's persisting with what she's doing. Something from the other side. So what needs to improve here? What do we do to make things better?
Find out a lot more about her. I mean, which underlie why she's not presenting.
Yeah.
To do that, they need to see her more frequently than first.
Yeah. Anything else? Anything over there in the back? Sorry? Yeah, I mean, there are lots of different things we can do there. But I take that to mean that I've got to do something different. So the issue here is not the patient, is that I've got to do something better. I've got to understand her issues. I've got to fight the system to get an earlier appointment than the 4 months that it is at the moment. There's all sorts of stuff, but the primary change has to happen with the clinician rather than the patient. And that's the case that I'm making, that you guys involved in the delivery of the healthcare service are, in various leadership roles, you need to drive change at the level of the clinician and beyond. And the reason why I say this, that it's really critical that we should be treating our patients in a timely way and in a way that hopefully gets better outcomes. I'm not sure whether I've got a pointer here. But this is, if we treat someone, I'm going to try and teach you the whole of rheumatology in the sort of 16 minutes I've got left by a couple of points. But this is the sort of the situation that we have. If you treat someone early, you get basically little further damage. If you wait for even a matter of 3 months or so, you find that the damage is 3 times as much. And if you look at mortality for rheumatoid arthritis, it's significantly more in patients who have rheumatoid arthritis than those who don't. And when we give people treatments, they have a positive impact. And you can do this for all sorts of different specialties and different conditions. This is osteoporosis, sort of normal osteoporotic after treatment, back to close to normal. So that's the responsibility we have. So we can have a significant impact on patients' quality of, hopefully on their symptoms, but particularly on their outcomes. We need to find a way of being able to effectively communicate and address their needs and their issues. So the figure of 80 billion is what we spend on long-term conditions. Can anyone tell me what proportion of your patients take their treatment, long-term condition patients? A number from that side, 1 to 100, 40%? 60%. Yeah, it's about right. Different conditions are different, but osteoporosis, at 6 months, only 30% of patients are taking their treatment. On average, long-term conditions, only half of your patients take treatment. So far as I'm concerned, the message I would give to David Nicholson and others and the leadership here is that we need to focus on improving these sorts of things and, just try and have a attempt to do different things where we can save 40 billion pounds of what we're spending. I mean, or rather get more use out of the 40 billion pounds that we're spending. So 50% of what we do does not deliver value because your patient's not taking your treatment. I mean, it's however effective or otherwise your treatment might be, it is not being made use of. I won't necessarily go through this because I'm sure you know about all of this, that there is some value in feedback. But the thing that I mostly want to discuss with you is that, feedback is the Department of Health policy, all that sort of stuff. Is it practical? And can it be done? And so what if you do it? What can you change? And we've got some numbers to share with you about, how it is in our situation. I'm sure you know all of this. I won't go into this, but just to say that patient experience is going to be a key outcome measure that you'll be judged on, or we'll all be judged on. And having patient's positive experience. So measuring patient experience and making sure that it's positive is a measure in itself, is something that we're going to be measured. We're going to be sort of assessed on. And obviously there's going to be a number attached to that. I'm sure this is the sort of time frame of how this change is going to develop. So this is the patient involvement project. So we've just been doing it because we thought that's what you did, and it appears that not many people are doing this sort of stuff anyway. And what we've developed is some questionnaires. We've got this 2-minute checklist. We've got a shorter questionnaire now. We've had some conferences where David and other people turned up, the GMC, the Royal College of Physicians. Actually, Bernard and the NHS Institute have been a huge mentor to the project, and they've supported all sorts of different things, including a video film. We've got some website material and all sorts of stuff. And actually, what I would like to do is to, if my minutes allow me, to show you some outcome data. I won't go through this, but we've been doing the various things to do with patient feedback for a very long time and looking to borrow from learnings from other areas such as team self-review is based out of work that's been done in the military. Red Arrows have a briefing and a debriefing approach that we've tried to adapt for our patients. This is where we have a few seconds of the video. This is just off the press. It's been released only yesterday. NHS Institute have kindly supported this. It's 7 minutes long. I'm not going to play it all, but just to give you a few seconds of it. And then if you're really brave, you can face the rest of it. But it gives you an idea of what we do in terms of the patient feedback in the clinic and what the patient's experiences and other clinical teams' experiences. Shall we just play the video then for a few seconds? There you go, we've got music.
What I would like to share with you today is the work that we've been doing on continuous systematic patient feedback. And basically what that is, that we look to get feedback from every patient that we see. The questionnaire has evolved over time. Essentially, it involves asking each patient to feedback on every occasion that they're seen, and then reviewing the feedback immediately at the end of the clinic or at the end of the ward round, and then any ideas and suggestions that they have, trying to put them into practice. We've focused on the clinical interaction and aspects about that. We want to capture how good the clinical interaction was from the patient's point of view, so we can identify issues and really try and improve that. And we've been using this approach for several years now, and in fact found it to have very many benefits for the team, for our processes, and the care that the patients are receiving.
I think I'll probably just leave it there, but there's several different sections. And it just walks you through and what the patients think of it. And actually, they don't find it that difficult, and they find it quite useful. We do a questionnaire before we see them. We declare what they expect to get out of the visit, like what the diagnosis is likely to be, what the prognosis is, what the can't read from this. Further investigations and sort of treatment options. And then there's a generic version. These are all on the website, so you're able to download them and do what you like with them and adapt them to your practice. And we've got a few different pioneers who are using them. This is the sort of the questionnaire. It started off, the Picker Foundation questionnaire was about 16 pages long. I never got any completed replies. Then we had 2 questions that was done by my secretary and a clinical attaché and a manager, would you believe? And that was very useful, but slightly limiting. And then this is the new questionnaire, which is gives them option to do some detail, but essentially, actually, we're just asking them 2 questions. And if you stay awake, I will tell you what those questions are.